Many of us get some opportunities to swim across troubled waters. Some are willing, some are not willing. My life was characterized by a situation where I had to live in the center of the city. My wife also is a doctor, she was practicing there. And this gave me an opportunity to realize a new world. This world consisted of people who did not have food, people who could not access care, people had such poor quality of life, and they were never able to receive whatever is due for them. So, whenever I used to travel from my home to Nimhans, which is about 5 kilometers away, the recurring theme was that there are so many people. Suppose if I had lived in a different locality in Bangalore city, I may not have had this experience. This is one part of the story. Most of my childhood was spent with my grandmother, uh, who had a business, and that was feeding the family. My father and his brother, they were in the armed forces. So, therefore, the only son for the family was myself. So, I had no childhood. And this journey with my grandmother gave me a new experience of seeing mentally disturbed people running across the street, homeless people feeding on unpalatable things, some mentally ill people being locked up in their house. So, this left a tremendous pain and also a challenge as to can I do something for them without realizing that my journey was too far away. This is one part of the story. And the third part of the story is the colleagues whom I met, Vandana and Vaishnavi, who initiated an action based on the problem that they faced, which resulted in complete life change for people with mental health, homelessness in our country. I was called upon by the Tata Trust to evaluate the Banyan. This was in the late 90s because by that time the solution I found for the homeless people in Bangalore city is to start recording their life, where they lived, what they ate, what they did. So, second Saturday and Sunday was off for us as central government servants. And I used to spend time doing these recordings and understand their lives, understand difficulties. What I arrived at is something which people laughed at me. I said, if you are going to do something for them, the National Institute will not allow you to do it. If all of these people come into the institute to occupy these beds, where will people with families come and use these services? It was very, very disappointing. But my professor, Dr. Srinivasamurthy, some of you might know him, he said, you continue. It is at that time I thought that I should work within the government system to make the government system responsible and care for these people. And that is when I found that there is a destitute relief center. It is funded by the Vagaries Citizens Pay. And these people are just taken Like, for example, they operate under Prevention of Beggary Act. Similarly, Kerala state also has Prevention of Beggary Act. They were taken and they were just fed. So this experience of working with the government system to make them responsible to provide care for, feed them, evaluate them, help them find jobs, help them trace their families was the background that I had started. And Banyan, which had was started in 1993, around the time that after 5 years, they had to evaluate. So I was asked to come and evaluate their homeless program. So my association with the homeless people with mental health problem is related to my childhood, my grandmother. My lack of support within the institution where I worked to respond to these people's needs. Third one is my eagerness to do something for these people because I stayed in the center of the city and the experience of evaluating Banyan resulted in a complete change. So Vandana and Vaishnavi's need for bringing about some change was so powerful that they took this lady and sought help from the public health system. They could not. When they could not, they were so frustrated, so disturbed with what has happened. They decided to take the next person to a house and started living with them. It was one which became five, and at one time they had close to 30 people for whom they had to care for, feed them. And they were barely 21 and 22 when they did this work. So it is friends who helped them, their parents who supported them, and their own courage and grit saw to it that they will never say no to these people, and this journey continued. This information reached the Chief Minister of Tamil Nadu, who said, if that is what is happening, I don't know why these two girls are doing this work. She further went into to understand what are the things that they are doing, what difficulties they are having. She granted 16,000 square feet of land. And they built this wonderful facility, which was referred to as transit care, in 1993. And today, we all have completed our 32 years of journey. At one point, I decided that I will quit the government service. I put in my papers in 2012. I moved to Chennai and I worked till about a year ago. I worked there, and now I am back to Bangalore because we are upscaling. So, what we all have achieved for the homeless people with mental health problem who are nobody's concern. Nobody wants them. They are pushed to the margin. They are the poorest of people. They are the most abused. Every lady who is in this context will not have had slept well for that particular night. She would not have been left untouched. She would have been abused. No, often combination of all of these factors makes it so difficult that, they have no courage to leave. You have to Give them the courage to say, yes, you can. We are there to stand by you. I'm sorry, this is a very emotional issue that we are dealing with. One is that these people have nothing, their balance is zero. You have to make them live, thrive, pull them out of that difficulty. And while doing this, Vanian taught four important values to all the people who worked. Accept the person the way he is or she is. Respect him or her. Support in whatever he or she wants to do. And the most important is no compromise for their dignity. Having done this, we were able to upscale the Banyan model of emergency care recovery center. You all know that there is no specific facility that existed for the homeless people. Country has 43 mental hospitals and we have about 728 district hospitals. Each one have 10 beds and most of the beds in the mental hospital were occupied by long-term patients, and most of these people did not find an entry into these hospitals. It was extremely difficult. The second most important issue is the legislation. The first legislation was called as the Indian Lunacy Act, 1912. 65 years later came the Mental Health Act. 30 years later came the 2017 Mental Health Care Act. So the first legislation was to protect the community from mentally ill people. Second legislation was to incarcerate them and provide care. It is only in 2017 that the rights of the mentally ill people were visualized, realized, understood as being important, and then we started working on it. Today, the Banyan model is replicated in 5 states. From 0 bed in 1993, now we have 704 beds created exclusively for the homeless population. The next important issue is that these people could not be sent back. While 70% could be reintegrated into the community, family reintegrations were less. There are a lot of women who did not have a place to go, who could not aspire to live in the community. Their life was confined to the emergency care recovery center or the transit center. The first initiative to accommodate these people in the community like you and me was initiated in 2012. Today, we have in again 7 states close to 500 people living a life of inclusion in the community like you and me. Some of these people work, manage their lives. Some of these people are married. Some of these people have independent living, from supported housing to independent living. So there are tremendous changes that has happened in the last 32 years of our work. What did we learn? We learned that people with mental health problems can be rescued, provided care for, recovery is possible, because science believed that chronicity resulted in very poor outcome and non-recovery, but we proved that to be different. There is 50 to 60% symptom reduction in a matter of 12 weeks to 16 weeks, and 70% can go back to the community to live with either families or independently or with support. The government of Tamil Nadu has made it absolutely important to say all the districts will have 30-bedded emergency care recovery centers. All the districts will also have Home Again. In the state of Kerala, the initiative was around Guruvayur and in Trishur. The work that we did with the 3 mental hospitals was to take them out into the community, establish Home Again in the state of Kerala. The government of Karnataka has identified 16 crores as the budget to establish emergency care recovery centers in all the 32 districts. And we have had 7 positive outcomes of selecting the ECRCs. We are running right now 2, and by the end of this year, we will be able to run all the 7. In addition to that, we have in Karnataka also Home Again. So at the end, what I have to say is, if you have the courage, conviction to address a particular issue, whether the government cooperates or not, you are able to make change and make the government realize, yes, this is a place where I should make an investment. And today, we have brought in a new dawn for the homeless, hopeless, mentally ill individuals in the country. Thank you very much.